Hi, everybody. I am Dr. Surapeneni Rao. I am an aesthetic plastic surgeon trained in Brazil. I did my 3 years of training program in Rio de Janeiro, and I work with cosmetic surgery more. So today I am going to cover about mummy makeovers. So coming to the point of mummy makeovers, so usually after a couple of pregnancies, there will be a lot of morphological changes that happen in a mother because of the childbirth and feeding of the baby and so many other things. Out of that, the primary one is the change in the morphology of the abdomen. So usually when there is a pregnancy is happening simultaneously in less than 2-3 years gap and without recuperating from the previous pregnancy like muscle toning and other things. So one may have the little separation of the muscles, which we call in medical terms as a diastasis of the rectus muscles. So because of that, the lower abdomen, that means something like a bit above the umbilicus to the down, there will be a lot of looseness is seen because during the final stages of the pregnancy, in the third trimester, because of the womb sitting over there, it causes this particular damage to the muscles. Damage in the sense the muscles, instead of they staying together, they go apart. So usually after first pregnancy, if they are very keen and if they do a lot of physical training and regaining back those muscles, tone and other things, sometimes it may be possible. But in certain group of patients where their height is not very tall and if the baby happened to be very big, this kind of a thing is going to happen. And also in case of twin pregnancy, 100% this is going to happen because to accommodate two babies, the tummy has to grow to reasonably big in size. So this kind of a thing can be corrected with the surgical way because however of physical training you do to correct that one, it might not be possible 100%. In those cases, we try to complement that along with the abdominoplasty because majority of the women, along with the this muscle looseness, there will be a lot of stretch marks in the lower part of the abdomen below the umbilical level, and there will be some amount of skin looseness also, like buckling of the skin or folding of the skin. So these kind of looseness also can be corrected with the tummy tuck. So it is also called abdominoplasty. So basically here what we do is, number one, we repair the muscles. Number two, we remove the excess skin. And number three, we try to reposition the umbilicus and to a correct anatomical level so that one feel more confident than what they were before, like post-pregnancy changes and other things can be avoided. Especially women with the modern work activity, like wearing any kind of a dress in a confident way. So that can be done. So this is about the abdominoplasty or tummy tuck in mummy makeovers. The second thing is going to be about the breast. So because of the lactation and nourishing the child, there is some engorgement during the pregnancy and following that while feeding the baby and other things, there will be some expansion of the skin and stretch marks and other things. There will be sagging of the breast. So that also can be done with breast lift or a small minimal reduction and a breast lift like thing. So this usually we do it about 6 months to 1 year after the pregnancy. That means basically we advise the mother to complete her feeding to the baby, because during the feeding time, whatever the antibiotics we give, that is going to cross the that are going to go into the baby through milk. So that's the reason we advise them to come after finishing the lactation. And during that time, we also recommend them to go for a balanced diet to increase their nutrition and other things, and also do some physical activity, because whatever is not possible to correct, that can be corrected by a cosmetic surgery. So to achieve that goal, so initially we will try to orient the people to have a healthy lifestyle and proper physical activity, and following that, whatever is not possible and whatever is bothering them, that will be corrected with this mummy makeover therapies.